Hi, Mr. Webster. My name is Kara Webster, and I'm here to perform your head, ear, eye, nose, and throat examination today. We've already performed a comprehensive history on Mr. Webster, and we'll proceed to the inspection part of the examination. Okay, so first we'll look at his skin, right? Before we do anything, we always assess first. So his skin looks normal for ethnicity, right? A little bit dry, I've noted to his skin, right? Then we check no scars or lacerations noted to his skin, okay? Then we will proceed. His skin is dry, however, it has no edema noted. Then we'll proceed to check his nails, right? Can you please give me your hands? Okay, so I'm checking for his nails, to see if there's any discoloration, if he has maybe any swelling to his nail beds, which he does not have, right? He has a capillary refill, which is less than 3, and his fingernails are intact as well. They're not dirty, right? And they're well manicured. He won't show his feet on camera, so we'll just pretend, right? His feet, his toes look good, just the same. He has all 10 toes, right? His toenails, his capillary refill, once again, is less than 3 seconds. His foot, there's no sores or redness or lacerations or marks noted to his nail beds, to his toes either. Okay, after that we'll proceed to check in Mr. Webster's head. I'm looking at his head for symmetry, right? His eyes look symmetrical, his nose look midline, his lips look midline as well. I don't see any cuts on his lips. His lips look pink, right? Looks moist, it's not dry, right? Then I am going to proceed to touch his head, right? Or palpate his head, I apologize. So his head feels warm to touch, right? There's no swelling. Please tell me if you feel any tenderness when I palpate your head. Any tenderness noted, right? There's no lumps or bumps or bruising noted to his head. Okay, I do also turn his head to make sure that he has range of motion as well too. Everything is well within defined limits. And then we'll proceed on to check Mr. Webster's eyes. Okay, so for his eye examination, first we are going to check his general vision, right? With the general vision, I'm gonna pretend this is my Snellen chart, so to speak, and I'll have him read. So you just cover one of your eye, and then tell me if you see a letter. What letter is this?
I.
What letter is this?
N.
All right, excellent. And you could cover your other eye. What letter do you see?
A whole bunch.
Okay, what letter is this one?
O.
What letter is this?
N.
Okay, thank you very much. Okay, after I've checked to see his visual acuity, then I'll proceed to check on his pupillary reactivity. Okay, hang on just a moment, Mr. Webster. Okay, for that, I'm gonna attach my source of light, right? Okay. Okay, so then I'm gonna dim the light in the room because I wanna see the size of his pupils and how fast they constrict as well. So then I'm gonna flash the light in his eyes, right? So I'm apologize. So his pupils are both reactive and they're both symmetrical in size, right? So as far as my observation, his pupils are 3 and they're briskly reacting to light, right? And that also, I'm gonna also check his consensual vision as well too. So I will shine the light in the left eye, right? And the left eye would constrict, and as I put it in the left eye again, the right eye would constrict, and I do it just the same, right? The right eye, left one constricts. Could you please open your eyes, sir? Thank you. The right eye constricts. Okay, so I'll check this as well. Very good. And Miss Works, I'm gonna ask you to look at the light source, right? Directing the light. Oh, maybe I'm too far away, I apologize. Okay. Then look away. Right, very good. Then look at the light, then look away as well. Okay, very good. Okay, then I'm going to check the red reflex of the eye. I'm gonna turn on my light source. Okay, so therefore it's my right eye would go to his left eye. My right eye was going to his right eye. Okay, so then we'll go. So my right eye is which one? My right eye is here. Okay, so we'll go to the right eye, and we hold your hand forward so you don't compromise the patient. Right, and you move out. Thank you, and then we'll do the same to the opposite side. Till we see the yellow field or the red field in some eyes. And then we'll go, and it looks within normal limits from where I can see. Okay, I'm gonna also check his peripheral vision as well too. So I'm gonna ask you to tell me when you see my fingers. You see my fingers? Okay, what about here? All right, excellent. Okay, then we're gonna also check for his peripheral vision as well too. So just follow my finger right with your eyes. So I'm gonna go in line and go up, down, middle, midline, and once again up, down, middle. Okay, I don't see any nystagmus. There's no extraocular eye movements noted, and so his visual field looks intact for me as well too. And also, I want to check. And I think that completes my eye portion for his examination as well too. Okay, after that we're gonna go on to check in Mr. Webster's ears. Okay, so for his ears examination, before we check anything, once again, we're gonna move towards the inspection phase of the examination. I'm checking his ears to see if there's any lesion. I'm pulling the ear to see if there's any tenderness, right? Any lumps or nodules noted. I don't see anything. So I'll proceed to start with whisper test. So I'm gonna cover your ear and you're gonna tell me what you're hearing.
Apple.
All right. And then please tell me if you hear this.
Baseball.
All right, excellent. Then we'll go on to do our Weber and Bryan test. Let me just get my tool. Okay, so with that, sorry. All right. So this is the Weber test. We're checking for his if he has lateral uniform hearing bilateral ears. Okay. So we're gonna tell me if you hear it in both ears or if you hear it in one ear greater than the other.
Same.
Excellent. Okay, then we go on for the Ryan test, right? So tell me if we're gonna check if ear conduction is greater than bone conduction, and the normal is that ear conduction is greater than bone conduction, right? Because the bone conducts here lesser. Okay. So please tell me if you hear it and when you stop hearing it.
I hear it.
Okay, tell me when it stops.
Stops.
Okay. Still hear it? Okay, excellent.
Stops.
All right, and as we do this, we should also be checking the time to make sure that we're checking the right as opposed to the left either to see if there's any discrepancies. All right, once again.
I hear it.
Okay. Tell me when it stops.
Stops.
Okay.
Stop.
All right, excellent. So we've completed that part of the exam. Now we'll proceed to the physical part of the exam, and we're gonna look into his ears to see if there's any issues with his ears. Okay. All right. So I'm gonna go. All right. I think I could do it from here. Let's make sure you're in focus. Okay. So I'm gonna use the ophthalmoscope. I'm gonna look into his ears. For the adult, you're gonna put up and up, right? If it was a child, I'll put up and back, right? So his the ear looks fine. There's no redness. I don't see any swelling. I don't see any his ear looks good. It's pearly white in color as well too. All right, and his eardrum looks intact. Once again, we'll do it to the other ear. For whatever you do the right, we do the left. So we'll look into the ear as well too. Right, it looks pearly white. I don't see any wax. I don't see any redness or swelling. And of course, he doesn't have any discomfort when we examine the ear. So it tells me that everything is within defined limits as well too. All right. After this, we are going to proceed to his nose inspection. So we can use the same too. Okay. So for his nose, once again, we are going to look at his nose. Before we do anything, we always inspect. So I'm going to inspect his nose, look at the color, look if there's any lesions. There's no lesions noted, right? I'm going to palpate his sinuses, right? Any tenderness noted? Any tenderness? Right? Not noted? Okay, very good. Look at his nose. So then I'm going to ask Miss Wood if you could tilt your head slightly backwards, right? And first, before we put the ophthalmoscope in the eye, the nose, we're gonna check the outer portion of his nose, right? Make sure there's no drainage. There's no drainage noted. I don't see any pus. I don't see any discoloration. It looks nice and pink, right? And both ears seem to be patent. Then I'm gonna look into the nose now, right? Sorry about this, right? Everything looks red, pink, not red, but pink in color, right? I don't see any swelling. I don't see any bumps. I don't see any lesions. Right, we're gonna do the same thing. Right, it's pink in color. I don't see any bumps, lesions, and there's no drainage or discharge noticed from the nose. And his septum, once it does not look deviated, it appears midline from my examination. Okay. After this, we will check his mouth, okay? For his mouth, okay, we're gonna pick that because I don't have my gloves. Okay, so his mouth, and then like I said before, his lips look normal. They're nice and pink. They don't look dry. I don't see any cracks. I don't see any bruising either. If you could please open your mouth, sir. All right, so then we'll proceed. I'm sorry, I always take this off. To look into his mouth, right? We're gonna check. So if you could please stick out your tongue, right? His tongue appears to be pink. The texture appears to be smooth. I don't see any lacerations or cut to his tongue, and the texture looks fine to me as well too. It's pink in color. We're gonna also open the mouth once again, right? We're looking at his teeth. He doesn't have any missing teeth. They're not yellow in color, they're not, what do you call this? He doesn't have any tooth decay noted either. And as we open his mouth, I don't see any sores noted to his jaws. His tonsil seems intact, right? His tongue is midline. There's no swelling noted to his tongue, right? Everything seems to be intact with his mouth as well too. And I would also press into his mouth with my fingers to see if any lumps or bruising noted. I don't see anything either. And do you feel anything abnormal in your mouth, Miss Webster? Okay, no, he does not. So I will say that's within defined limits as well too. Then we're gonna proceed to check his neck, right, and his tonsils. So we first look at his neck, right? See if it looks swollen. There's no swelling noted. It looks aligned and I guess symmetrical. But it looks aligned to his shoulders, right? It doesn't have any deviations or curvature noted to his neck, right? And then we're gonna proceed to check his lymph nodes to see if there's any swelling or anything. If he has a swollen lymph node, it would be pea size and shape, and it would also be mobile as well too, right? So we're gonna start with checking his peri-ocular lymph node, right? We use the pads of our fingers and we check for the peri-ocular lymph node. Then we go to the posterior ocular lymph node, right? Then we go to the tonsillar. Then we go to the mandibular. Then we go to the submandibular, right? Then we go to the cervical, right? And then we'll go to the deep cervical, but normally as per the readings, you can't see the deep cervical, so you would ask him to turn the head slightly, right? And then you will trace it here. So then you look for the deep, deep cervical, right? Then you go to the then you go to the clavicular, right? Then the subclavicular, right? And then you go to the anterior lymph node in the back of the neck as well too. Right? Everything seems fine, right? Then we're gonna palpate his thyroid, right? So with the palpation of his thyroid, we're gonna go, I'll go behind him. And then, oh, sorry, yeah, thank you. Then I'm gonna use my fingers once again and we're feeling for his trachea, right? Once I feel the trachea, once I feel the trachea, we're gonna palpate. I'm gonna ask him to swallow, right? And we're looking for the rise and fall of the trachea. Everything seems fine. There's no deviation. There's no swelling. He has no tenderness on palpation, right? So that seems fine as well. Another thing that I failed to do before that I have to do is I have to check for his TMJ, right, which would be right here and here as well too, right? And everything seems fine. And that concludes our Heent examination. Thank you.